First time a more contagious variant of COVID-19 has been detected in Massachusetts. And here to explain how it could impact your health is Dr. Rob Duncan, an infectious disease specialist at Lahey Hospital in Burlington. Thanks for being here.
Thanks for having me.
So this is what we know. This patient is a Boston woman in her 20s. She tested negative before she boarded a flight from the UK to Logan. So that was on January 3rd. She became ill sometime after she arrived in the U.S. On Saturday, the state learns it's this variant. Does this discovery raise new concerns for you, and why?
Well, it certainly is something that we've been expecting to happen once we heard about this variant occurring. And viruses, this is what viruses do. They mutate and create different targets for us and different behaviors. So it's not a big surprise. I think the concern is that this virus is appears to be easier to transmit than other strains of the virus. But it appears that it also is transmitted in largely the same fashion as some of the other strains, as far as we know, although we're gaining knowledge all the time.
And so when we talk about transmission and the number of cases, about 10 days ago, the state was reporting more than 7,000 new COVID cases every day. We've seen that number really drop steadily. Today, it was just above 3,000. Do you think that holiday surge is over at this point?
I certainly hope so. I've learned not to be too secure in those predictions. I think that things have been bouncing up and down.
Let's talk about the next steps. On Wednesday at noon, we have a new administration taking over the federal vaccination program. What do you want to see done on day one?
I want to see exactly that. I want to see the federal takeover of the program so that we have a coordinated national response, get all the resources that are available from the federal government, the Defense Act, to marshal those resources and coordinate them in an equitable fashion around the various states, rather than having everybody doing whack-a-mole kind of approach to response to this virus. I think we need coordination and collaboration and trust in science.
And along those lines, the president-elect, to your point, is planning to ask Americans to wear masks for the first 100 days of his administration. In Massachusetts, anyway, it seems like people are already doing this routinely. So the question that we're wondering is, why isn't the state doing a lot better than the rest of the country when we look at numbers and transmission?
Well, I think it's more complex than that.
Okay.
I think it's laudable that most people in Massachusetts are using masks, and I think that advice is it's great advice for the rest of the country. But that's going to work better in a place where you have dense population, like many of the Massachusetts cities, and it's going to be harder to have an effect from masks in an area where you're out in very lightly populated areas of the country. So we have a lot of the risk factors for COVID concentrated here, and I think the mask precautions are an essential piece of what we're doing. Okay. I would strongly encourage that for others elsewhere, and I think this approach to getting a more national compliance with that is really important.
All right, Dr. Duncan from Lahey Hospital, thank you very much for your time. We appreciate it.
You're welcome. Thanks.